Good afternoon, folks, and thanks for joining Reimagine's webinar today, LGBTIQ+ people and mental health and the NDIS. This webinar is brought to you by the Mental Health Coordinating Council, the peak body for community health organisations in New South Wales as part of the Reimagine Stage 2 project. I just want to say thank you for the opportunity to facilitate this webinar. My name's Charlie Wilbridge and my pronouns are they, them. Before we get going, I just would like to acknowledge the stolen land and the traditional owners of all we're meeting across the country today, specifically where I am, the Gadigal people, where I work and live. I'd like to pay my respects to elders, past, present and emerging, and also acknowledge their continued connection to culture, community, waterways and land. So Reimagine Today is an online resource to support people living in mental health conditions to access the NDIS through the psychosocial disability stream. Reimagine Today was funded by the NDIA's Linkages and Capacity Grants, and in 2019 and 2020, Reimagine Today was improved to be more useful to a broader range of communities. These included Aboriginal and Torres Strait Islander, culturally and linguistically diverse, rural and remote, and LGBTIQ+ people, which we're here to talk about today. And alongside these communities, MHCC worked with project partners, in this case the National LGBTI Alliance, to co-design these resources with people with lived experience. So I just would like to acknowledge lived experience, people with the lived experience of mental health conditions, their families and carers, including those here today, and recognise that there are many contributions to the community in the mental health service sector. First up today, we have Amelia Arnold, who is the LGBTI Suicide Prevention Project Officer at Sawn Harbour Health. So I'd like to hand over to Amelia now. Thank you.
Thank you so much, Charlie. Appreciate that. I'm just going to click to the next slide, just so folks can see. So, hi everyone. It's a pleasure to be with you this afternoon. I've been asked to present to you folks as I coordinate a training project through Sawn Harbour Health, formerly known as Victorian AIDS Council, which is funded through the National Suicide Prevention Trial. So, down here, we are very fortunate to be one of the two primary health networks in Australia that is funded to deliver suicide prevention activities specifically for LGBTIQ+ communities. So I'm going to be walking you through some LGBTIQ+ affirming practice tips, but also some mental health and suicidality statistics and research that we have gathered during this project, as it is a co-design-led and lived experience-led project. So I'd like to echo Charlie's acknowledgement of country and acknowledge that where I am, I'm on Wurundjeri land, so I'd like to acknowledge elders past, present and emerging and extend my respect to them, and also any Aboriginal or Torres Strait Islander folks joining us today. If you've not heard of Sawn Harbour Health before, you may know us by our former name, Victorian AIDS Council. So we have a rich history of working with the LGBTIQ+ community and people living with HIV. And these are just some of the services that we offer. So as I mentioned, the work that we do in this LGBTIQ+ suicide prevention training project is funded by federal money under the National Suicide Prevention Trial through the Northwest Melbourne PHN. So we know that LGBTIQ+ folks who are engaging with mainstream services do feel safer in those interactions when support services or service delivery personnel have undergone some training in LGBTIQ cultural awareness and sensitivities. We also know that LGBTIQ+ folks are at greater risk of poorer mental health and suicidality, not because of who they are and their identities, but because of how they are treated walking through the world. And we also know that LGBTIQ+ folks are less likely to seek support during a mental health crisis for fear of discrimination or fear of violence or harm. So for some folks who may not be as familiar with LGBTIQ+ communities, I found the biggest acronym I could on the internet for our presentation today, and I thought we would quickly run through it. So when we're talking about the LGBTI, LGBTIQ, LGBTIQA+ acronym, there are a range of different experiences and identities that are encapsulated within that acronym. So the LGBTIQ+ acronym relates to diverse sexualities, sexual orientations, diverse genders, and people with diverse sex characteristics, secondary sex characteristics, so intersex folks. So I've broken that down for you all. So diverse sexualities being the highlighted slides here. So I'm sorry, the highlighted letters here. So lesbian, gay, bisexual or multigender attracted, queer, questioning, asexual, aromantic, and pansexual. Bisexual and pansexual are both identity terms that relate to multigender attraction, if they're new terms for you. Then diverse genders, including transgender or trans colloquially or for short, gender diverse, non-binary and queer, and questioning as well. And when we're talking about diversity in sex characteristics for intersex folks, that's the I in this acronym. So I get asked a lot, why are we still talking about sexuality and gender? Well, sexuality and gender are integral parts of being a human being, and our sexuality, so who we experience sexual, romantic, emotional attraction to, and our gender identity and gender expression play a really important part in our identity, our sense of self, how we move through the world, and how we are treated by others. Additionally, love and affection, sexual intimacy all contribute to our health overall as people and to our individual well-being. So we can't talk about our health and our wellness without also embracing diverse sexualities, diverse genders. So I'm going to talk a little bit about language because this is one of the big things that practitioners within these spaces, by knowing correct language and by understanding the impact of the language that you use, you can convey either that you have some literacy with LGBTIQ+ community issues and sensitivities and culture. You can always, you can also convey that you don't have some familiarity, and for LGBTIQ+ consumers that you're working with, this can signal that you may not necessarily be a person that is safe to engage with their identity in either sexuality or gender. So it's important to understand what language LGBTIQ+ communities can use, and also mirror the language that a person uses for themselves, for their own sexuality, for their own gender, and the pronouns and sexuality or gender terms and identity terms that they use. Cool. So folks may have heard of pronouns before. If this is a new concept to you, I'll just quickly outline that pronouns are words that we use to refer to a person other than their name. So the wonderful Charlie introduced themselves at the start of this session. They use they and them pronouns. I use she and her pronouns, which was on my opening slide. So typically she and he are gendered pronouns, and she is typically used by women or feminine folks, and he is typically used by men or masculine folks. They and them pronouns are gender neutral pronouns that people may use for themselves. Typically used by genderqueer and non-binary identifying people. However, anyone can use they and them pronouns if that is their personal choice. So familiarizing yourself with the introduction of your own pronouns when you're working with someone, not necessarily from LGBTIQ communities, but for all people, is a really important part of providing a safe cultural space for LGBTIQ+ individuals. By using your pronouns and introducing yourself with your pronouns to all people that you work with, it also takes the, not pressure off, but you're not singling out LGBTIQ plus individuals because you also won't know if a person is LGBTIQ plus unless they tell you. We don't all walk around with t-shirts on, indicating that we are from the LGBTIQ plus community. So it's a good practice to introduce yourself and your pronouns to normalize that process, and also to create space for the person that you're working with or your colleagues to be able to tell you their pronouns. So I've done an example example sentence down here, for example, just to illustrate using gender neutral pronouns. So I'm talking about my friend Sam in this instance. So Sam is studying nursing. They're in 3rd year and their marks have been amazing so far. I'm so proud of them. Cool. Now we're going to talk briefly about LGBTIQ plus mental health and some stories, not about suicidality, but some feedback that we have had from LGBTIQ plus mental health consumers through our focus groups. So the training project that we run is with mainstream services. So we go in and work with individuals and with teams who will engage frequently with LGBTIQ plus consumers and work with them to develop ways of doing this safely that create cultural safety for LGBTIQ plus folks, while also taking into account some unique vulnerabilities, unique experiences for LGBTIQ plus folks. So I know that in this webinar, there's going to be a mix of consumers and of service providers. So I'm going to be aiming to talk to both audiences whilst I go through. So for service providers and folks who are working to support LGBTIQ plus folks, there are a range of different experiences that can impact on LGBTIQ plus folks living in a society that is structured around heteronormativity, so assuming that people are straight or heterosexual, and also assuming that people are cisgender, so not transgender. So the experience of minority stress is one impact of for LGBTIQ plus communities living in a society that is primarily set up in structurally for heterosexual and cisgender folks. So minority stress being the ongoing stress or anxiety that is a result of being part of a stigmatized minority group. So either being a member of a diverse sexuality group, so lesbian, gay, bisexual, pansexual, asexual, or being having an identity that is gender minority, so being transgender, gender diverse, non-binary, etc. Also, the implication that people have to come out themselves, as most folks will assume people are cisgender or are heterosexual. So that process of having to correct people and come out all the time can be really, really distressing for a lot of folks. For some people, not so much, but it just depends on your story and of your experience with talking about your gender and talking about your sexuality and who you're speaking to. So some folks will think that coming out is something that LGBTIQ plus people do once and then it's all done, all finished. But for a lot of people, you have to come out not only multiple times, but sometimes multiple times a day or sometimes multiple times a week, because people will assume something about you based upon either how you present or how you talk about your relationship or your partner or partners. Incremental trauma is another thing that can contribute to poorer mental health for LGBTIQ plus folks. So the additive impact of oppression, of discrimination, of having service experiences that aren't set up for someone with your lived experience, and also the internalized homophobia, transphobia, or biphobia that some folks carry with them. When we're talking about LGBTIQ mental health and suicide risk, these are some statistics that I've sourced from the National LGBTI Health Alliance. They do fantastic work in this space. So when we're talking about suicidality, LGBTIQ plus people are more likely to have thoughts of suicide. So lesbian, gay and bisexual people are over 6 times more likely to have thoughts of suicide than their mainstream peers. Trans and gender diverse folks are nearly 18 times more likely to have thoughts of suicide than their mainstream peers. People with an intersex variation are nearly 5 times more likely than their mainstream peers to have thoughts of suicide. And these statistics increase if a person experiences abuse and harassment. Additionally, when we're talking about engaging in suicide behaviours, LGBTIQ plus young people are 5 times more likely to engage in suicide behaviours than their mainstream peers. Trans and gender diverse folks are nearly 11 times more likely to engage in suicide behaviours than their mainstream peers. Folks with an intersex variation are nearly 6 times more likely to engage in suicide behaviours than their mainstream peers, and these statistics increase when people experience abuse and harassment. So when we're thinking about working with LGBTIQ plus folks, these are things to keep in mind, but it's important to note that poorer mental health outcomes and suicidality are not inherently attached to LGBTIQ plus identity. It's not because people are LGBTIQ plus that they have diverse sexualities or diverse genders that mean they are more likely to have thoughts of suicide or engage in suicide behaviours. It's because of how they are treated walking through the world. This can have an accumulative impact on some LGBTIQ plus folks, and so it's important to keep that in mind. Additionally, I've listed some additional vulnerabilities that LGBTIQ plus communities can experience. Some big ones at the moment include being disconnected from community because of COVID. So not being able to engage in supportive communities, especially for some young people at the moment who may be in homes that aren't as supportive of their sexuality or of their gender. Again, the ongoing burden of self-advocacy, that's also a great opportunity for some people, but for some folks it can be difficult to advocate for yourself in systems that aren't necessarily set up for your experiences. So I've just listed a few. Feel free to have a read, but I won't read them all out to you folks as I've gone through some of these already. Also, it's important to note that just because a person is LGBTIQ plus or belongs within the LGBTIQ plus community doesn't mean they also don't experience other minority identities, which have an intersecting experience and often an additive impact on that individual. So just because a person is LGBTIQ plus doesn't mean they're not also First Nations, a person of colour, experience family violence or poorer mental health and AOD concerns, homelessness, experience disability, are people of faith, younger people, older people, or sex workers. So just a range of additional needs that people may have. So we don't just fit neatly into one box. People may have intersecting experiences that are important to consider as well. When we're talking about why people may not necessarily come forward for support when they need it, some LGBTIQ folks have, within our focus groups that we ran last year, reported that there was a fear of being pathologized by your gender or your sexuality. We have a history of being institutionalized in our community. Other folks mentioned that they assumed a service would be unsafe until proven otherwise. Not having anyone to accompany them or advocate for inclusivity. Some folks reported feeling undeserving of help, and some people said that they expected that if they were to enter a service, they would have to educate the staff about what their gender or their sexuality or their sex characteristics entailed if folks weren't familiar with those terms. Some poorer experiences of service that people reported in our focus groups were when services claimed to be trained and safer spaces, and then the person didn't experience a engagement that was culturally safe for LGBTIQ plus identities. The use of gendered language and also of gendered spaces, so gendered bathrooms is one example. The policing of gender, so boys look like this, girls look like this, as an example within a service. The process of being dead named or misgendered. So if this is a new term, that's using, for a trans or gender diverse person, using a name that they were given at birth, not a name that that person uses now. And similarly with misgendering, using the gender a person was assigned at birth and not the gender that they identify with. So that process can be largely distressing for trans and gender diverse folks. Again, having to educate staff on LGBTIQA+ topics, and the assumption that you are heterosexual until proven otherwise, cisgender until proven otherwise, or assumptions about your body and your medical needs based upon your gender. These were some quotes from folks that we worked with. So navigating the process of the system often increases my distress and suicidality. It can be re-traumatizing to access a service and have your identity invalidated. And distress is a normal reaction to a system that's not set up for you. And all of these things are backed by research out of La Trobe University. So in 2019, just last year, it feels like many years ago, but just last year, the Understanding LGBTI+ Lives in Crisis, a study which was done with the Australian Centre for Sex, Health and Society at La Trobe Uni and also with Lifeline, indicated that 71% of LGBTI+ Australian people did not reach out for services or help during their most recent personal or mental health crisis. And Dr. Andrea Walling is quoted as saying that we know that from previous research, there is a higher rate of suicidal ideation, self-harm and poor mental health in LGBTIQ+ folks, and that the main reason people who participated in this study chose not to use crisis counselling or seek support was the anticipation of discrimination. So this is a really pervasive issue for a lot of LGBTIQ+ consumers who are moving through mental health spaces. So things we need to consider if we're in a position of service delivery. That all being said, the LGBTIQ+ community have many resilience factors. Most of us are still here and we're grateful for that. And celebrating these, the resilience of LGBTIQ+ folks is essential in working collaboratively and in an affirming way with LGBTIQ+ people. So some of these strengths and protective factors that LGBTIQ+ folks have developed over time can include the ability to create your own identity and definition of self and living by your own understanding of your sexuality and gender, embracing of self-worth, being aware of oppression not just within LGBTIQ+ communities but in other minority groups as well, being connected with a supportive community. Lots of LGBTIQ+ folks are very active in social activism, sometimes because we have to be when advocating for change, but that can build some resilience in LGBTIQ+ communities, being the change that we want to see. Cultivating hope and strength for the future, and additionally being a positive role model for others and for younger people especially. Now, when we're talking about affirmative practice, I've mentioned that a few times. So what do we mean by that? So affirmative practice is creating safety within a service or a position of support for LGBTIQ+ folks. So we know that services which are not known to be accessible or safe are assumed to be inaccessible or not safe. So LGBTIQ+ folks are more likely to assume that a place is, or a service or a support worker is more likely to discriminate against them than they are to assume that that is going to be a safe exchange. So we need to, as workers, demonstrate our allyship to LGBTIQ+ communities. Now, how can we do that? So that we could talk about that all day. I often do, but for the purposes of today, we're just going to have a quick conversation about that. So that can include embedding principles and guidelines into organisational policy and procedures to make sure that an organisation's intent to have LGBTIQ+ affirming, inclusive practices is adopted. So organisationally, this can look like demonstrating your organisation is LGBTIQ+ inclusive through the use of visual aids, through the inclusion of LGBTIQ+ people in marketing and branding and posters and those kinds of things. A beautiful poster I've included in this slide, developed by Rainbow Network and Zoe Bell Gender Collective, saying that we celebrate gender, sexual and bodily diversity, which is gorgeous. Developing a referral list and referral processes to LGBTI+ friendly practitioners and organisations is super helpful for when you're in a service provision or support provision role and are working with LGBTIQ+ consumers. Include explicit reference to LGBTIQ+ in policies and procedures. Making sure that you have an advisory group which can inform your work, because it's best to come from folks with lived experience, of course. Ensuring forms, documentation and processes are affirming for LGBTIQ+ folks. And of course, training can be really helpful in this space as well. For individual support workers and individual practitioners, the use of respectful language and terminology, using gender-neutral, non-discriminatory language if we're asking questions, being curious but respectful of a person's identity, affirming identities and experiences, also being aware of your own privilege walking through the world and engaging in some of these discussions, and not projecting, of course, own personal beliefs and values. So putting it all into practice, what can this look like? So adopting a person-centered approach when we're working with folks, not just LGBTIQ individuals, asking what pronouns people use and also introducing yourself with your pronouns and then using the person's pronouns when they let you know the pronouns that they use for themselves. Also not assuming a person's pronouns based upon their appearance or their gender. Not assuming someone's gender-based, similarly about pronouns, not assuming someone's gender based on their appearance or their voice on the phone. Never commenting unnecessarily on a person's appearance. Understanding that each person is an individual and that there's no one way or right or correct way to be an LGBTIQ+ individual. Identifying learning gaps and needs. So we may know more about some members of the LGBTIQ community than others. So identifying where our learning gaps are and educating ourselves in our own time. Also acknowledging that we aspire to create safety for LGBTIQ+ individuals as workers, but even if we think that we have created a safe space, it's up to the person who is LGBTIQ+ to decide for themselves if that is going to be a safe space or not. So we can't necessarily assure safety. We aspire to create safety for LGBTIQ+ people through all the actions that we do and actively supporting LGBTIQ+ folks in our practice. So how can you demonstrate your allyship to LGBTIQ+ folks? Making sure that you wear your allyship every day, not just on special occasions like Ida Hobbit and wear it purple. You can also make sure that you are part of the change and advocacy within your organisation. So calling out negative or discriminatory behaviour when you see it, have an obligation to challenge folks who are creating unsafe spaces for LGBTIQ+ individuals and making sure that you can create that safety within your practices. So that is me. Thank you so much, folks, for your attention during my slides just now, and I will throw back to Charlie. Can't hear you, Charlie.
Always one. Thanks, Amelia, again. As I was saying on mute, it's really important that we get a good understanding of lived experience of the people we're actually trying to talk about today. And I understand that folks on this call may already have that understanding, but it's nice for Amelia to come on and give us a baseline so we know who exactly we're talking about. And so before we get into the resources, in the spirit of anticipation, I just want to talk a bit through the process, and it was co-designed with folks within the LGBTQI+ communities, and we did face-to-face co-design and also online, which ensured that we had a national voice at the table. And I think something to highlight is that when we say co-design, this was actually co-design where the consumers were the ones who designed what did they think would help in their experience to access the NDIS, down to what colours are used on the website as well. And so I'd like to invite Asha Zappa on screen, if that's okay, who's an art therapist and lived experience advocate, and also work as a mental health promotions manager for Way Ahead. Thanks for coming on, Asha.
Thank you for having me.
Thank you. Now, Asha was part of this co-design process, and I do have some questions for Asha, and then I'll let anything else that you'd like to contribute, Asha, after that. But we know that there can be barriers to accessing the NDIS, especially in our communities. I was hoping to focus, though, more on some practical tips. What is your advice for applying to the NDIS, or what information did you collect?
I think one of the really important things is having somebody who can support you. It's a really stressful process, and especially for people with what the NDIS calls psychosocial disability, mental health issues, it can be really anxiety-inducing and upsetting. And a lot of the language that the NDIS uses is not recovery-focused, which a lot of mental health care is. So having somebody that can support you through that process, either somebody like a friend who's been through it, or a professional, or even just somebody to debrief with, and just being aware that it can be a really stressful process. I think that's the main thing I would say, and somebody to help you navigate the info, because a lot of it is complex and confusing. And one of the things that I really like about the Reimagine Today website is that it breaks it down and gets rid of some of that confusion, which is really helpful.
Yeah, great. Thank you for that, Asha. And I think that's the purpose, is to make this accessible so that those who are most vulnerable can access support. And just coming back to the process, co-design isn't always an easy task, especially when there's so many different psychosocial experiences, such diversity within LGBTI communities. I was hoping you could talk a little bit about your experience being involved in the co-design.
I think there's always an element of bracing yourself before you go into these things, and especially being that it was connected to the NDIS, you know, the anticipation of things being difficult was definitely there. But seeing that the group was being run by people with lived experience and by people from the LGBTIQA+ community really helped, like especially as walking into the room, that part of it. But then the process itself, I really noticed the way that all sorts of things had been thought out. So different styles of communicating had been accommodated for. There was a combination of, you know, sort of big group discussions, small group discussions, opportunities to write for people who didn't feel comfortable being more verbal. And the expectations for safety were really clearly set up from the beginning. And I think that's the benefit of having people with lived experience leading the process as well as being involved in the process. Those things had been thought of. And I've been in, you know, I've had the opportunity to do a couple of different projects, you know, with people with lived experience, and as well as having people without lived experience in the room, or without people who were not part of the LGBTIQA+ community. And I really noticed the difference when the leadership comes from those communities. And yeah, there are barriers, definitely, but I think, yeah, having the leadership and having the safety expectations set up from the get-go was really key to making it work. And the other thing is making space for difficult experiences. I think that was something that worked really well, and allowing people to express concern about the NDIS or express their difficult experiences in mental health care. That was really key as well. There was definitely space for not great experiences.
Yeah, great. Thank you for sharing that, Asha. And I think it comes back to something that you hear often in the lived experience mental health suicide prevention space is nothing about us without us. So it's good that we were able to have this opportunity with MHCC to get this work and resources done. So I guess I'm just going to switch over to the moment you've all been waiting for, and just to go through some of the resources in the LGBTQI+ community hub. I'll run through some of the resources. Ashley, you're welcome to jump in at any point, but up to you. So introducing the LGBTIQ+ Reimagine Today Communities Hub, Communities Hub. And this is a place which all of the resources are kept. And just a reminder that they were co-designed by all folks with lived experience, driven by community in what they think and through their experiences, what they think will be useful for them. So you can reach the website there, and they're all there to support you. So there's a variety of resources. It's around preparing for the NDIS with specific tips and advice around lived experience. It's used to share information, to advocate for yourself. You can hand these out to carers or workers. There's practical workbooks which can be printed out. And there's all sorts of tools as well, including things that can prepare you for difficult conversations. Now, we heard from Amelia earlier around being misgendered or making assumptions around pronouns, and sometimes it's hard to advocate for yourself. And so there's some examples from our co-design teams around how to handle those situations. And I'll just flick over to some visuals. So these are some of them. So like I said, the interactive resources on the hub, there's e-learning resources which are focused on lived experience and recommendations for how to work with LGBTQI people and communities, real world success stories. We often hear the negatives like Asha touched on before, but it's nice to hear some successes and how they actually occurred, what were some strategies. There's videos of personal lived experience, such as barriers and challenges, the difference the NDIS can make to your life, and talking about psychosocial disability and the actual lived experience and stigma and discrimination. And like I said, there's printable resources such as the toolkit with examples of difficult conversations, and also an about me sheet, so you don't have to continually keep repeating your story, which is something that comes up, I think, a lot when we're working with lived experience, is that I have to tell my story again. I'll just check in, Asha, if there's anything you wanted to add around the resources before I ask you and Amelia another question.
I think just in terms of the process of being involved in designing those, I really appreciated how no detail was too small. I believe we had a conversation about the number of fingers on one of the image's hands or something. Like, it was that small a detail. And it was wonderful to be part of a process that could do that.
Yeah, great. Thank you. I'll invite Amelia. So you've just presented on the lived experience of LGBTIQ+ people, barriers to service, and how we can do affirmative practice. From your perspective and considering what you've just presented on, I'm wondering how you think people working in this space can use these resources.
I'm thinking the toolkit that can be printed out. So those templates could be really useful for folks who are LGBTIQ+, if they want to disclose their pronouns or their gender or their sexuality, just so it can avoid the hopefully the process of being misgendered or of having assumptions made about your sexuality or your gender or the pronouns that you use. So I'm wondering, on one of the toolkits, there's a yes and an important, and those kinds of fields that can be filled in by folks who are utilizing these for work with support workers. So possibly if you're wanting to share or disclose those parts of yourself, that could be a good way so that everyone is on the same page going in. Additionally, if there is language or words that you definitely don't want people to use to describe you, or as part of your support work, listing those on those toolkits could be really, really useful to facilitating respectful and affirming engagements.
Yeah, thanks, Amelia. And building on that, like I was saying, where people get tired of telling their story, sometimes you also actually don't have the physical energy, or people refer to the spoons, to continually challenge or push back. So that's really good practical advice, Amelia. And I just want to bring Asha back in. What are some of the key benefits of these resources for carers and community members?
Well, like I said, having a support person is really helpful, and these resources are something that a support person can help you go through to break it down, make it a bit more legible and passable, and just generally help with the understanding. But I think for our community in particular, having people who have already thought about those moments where you do have to brace yourself and thought about strategies to address that really alleviates some of the stress and that anticipation of microaggressions. And as part of the process, we really went through and it's like, well, what happens at this stage, and what might be all the things that we encounter? And so those things that can make you feel quite anxious have been thought through, and being able to, instead of go, oh, what are the 50 things that might happen? You've got a list, you've got a thing that you can fill out. And that is so beneficial, and for individuals, for communities, and for support people as well.
Yeah, great. So practical, plain language, and not having to repeat yourself. Thank you so much. So I just want to let folks know that this is being recorded and will be automatically sent to those who are registered and then available more broadly at a later date. I'd just like to thank Asha and Amelia for taking the time to present and answer some curly questions with us today. But also want to really thank MHCC and the NDIA for the funding and the great partnership in working to develop these resources. They are live at Reimagine today, and there's a contact up there now on your screen, reimagine@mhcc.org.au, if you have any feedback or any questions. So I just thanks again, Mental Health Coordinating Council, and have a good afternoon.